مشاهدينا، اليوم احنا في مركز بورن هول. هذا المركز المتخصص واللي احتوى أول طفل أنابيب في العالم. يشرفنا وسعيدين بوجود هذا المركز عندنا في إمارة دبي عشان يخدم المجتمع والمنطقة. Good morning, Dr. David.
Good morning.
Thank
Welcome
you.
to Born Hall.
Thank you very much again for having us with you today.
You're welcome.
We would like to have a tour in the clinic. If you don't mind, later we'll go on an interview to find out more information about such prestigious center.
Okay, I'd be very happy to show you around.
Please.
Please, come this way.
Doctor, right now we are coming to the most important part of this clinic. Can you tell us more about it?
Yes, we're coming now to a window into our clean room. Now, the central part of any IVF clinic is the laboratory. This is where our patients' eggs and sperm are kept, and this is where the treatment is carried out by the scientists, the embryologists, to fertilize the eggs and grow the embryos. This is for patients having IVF treatment and patients who are going to have any kind of genetic diagnosis made. Their embryos are treated here. Now, this is not quite a sterile environment, but it's almost sterile, and this really facilitates the growth of good quality embryos. And I feel it's the most important feature of the clinic. One treatment that has become much commoner in the last few years is ICSI. This is intracytoplasmic sperm injection. Now, where the man has a very low sperm count, we don't have enough sperm to fertilize his wife's eggs. So what we actually do is we can inject a single sperm directly into the egg so that the egg will fertilize. And this is particularly useful in this region because unfortunately we see quite a high incidence of sperm problems. So this screen here is showing a needle going into the wife's egg. There is a sperm inside this needle, and James is injecting that one sperm directly inside the egg. And this egg should now fertilize, and over the next few days will become an embryo.
I see. We can see the sperm, it's already injected.
Yes.
Thank you very much for having us today in Bone Hall. Please, Dr. David, can you give us a brief what makes this center unique?
Thank you, Dr. Merriam. I'm very happy to be here, very happy to be talking to you. Bone Hall Clinic has been in Dubai now for about 15 months. We've been open to patients for about 15 months, and we are a sister clinic, if you like, of the original IVF clinic in the United Kingdom, Bone Hall Clinic near Cambridge. Now, Bone Hall Clinic near Cambridge was founded in 1980 by the two doctors, one gynecologist and one scientist, who were responsible for the first test tube baby, the first IVF baby. And over the years, Bone Hall Clinic's become very famous for offering very high quality services to the south of England primarily. And we're now developing overseas clinics. So we have the clinic in Dubai and we have two clinics in India as well. And what we want to do is to bring the high quality of service and the years of experience that we feel is unparalleled really to this region, to Dubai in particular.
Bone Hall is known as one of the leading centers of IVF. Can you tell us more? What is the importance of having such center in Dubai and in the region in particular?
Well, Dubai is known for a very high standard of healthcare in the first place, and it's become a very popular destination for many healthcare providers. But within the local population itself, there is actually quite a significant need for fertility services, because we do see some very specific problems that arise in this region, in the Gulf in general, and the United Arab Emirates, relating to fertility. And it's important that high quality services with good success rates and a full range of diagnostic services are available to people so that they can maximize their fertility and maximize the quality of their fertility, if you like.
Dr. David, can you tell us more? What's your plan to make sure that such services are continued and these experiences are exchanged with the local professionals?
Oh, we are very keen to interact with the local community and work with a number of government organisations. In particular, we're interested in the overall instance of fertility and infertility in the region. As I mentioned, there are a number of problems quite specific to this area, or that are commoner in this area. And then because of the demographics here, we perhaps see quite a high instance of genetic issues, and we're very keen to work with a number of prestigious genetic organisations to see how we can assist in helping solve some of these problems.
Would you like to tell us some of successful stories of any particular case which are still in your mind?
Well, interestingly enough, yesterday a couple came in to see us with their fairly new baby, 3-4 months old, I think she was. And this was a couple who had been trying for a pregnancy for 11 years. They'd had many cycles of IVF in other clinics and had come to us and had a successful result. And that really is what it's all about, is getting a successful result, a healthy baby and a happy family.
Thank you very much, Dr. Dave, for having us here today, and wish you all the best again.
Thank you very much, Dr. Marriam. We've been very happy to have you visit Bورن Hall Clinic and hope to assist the community in achieving a lot more happy families and happy babies.
Sure, thank you very much. مشاهدينا إن شاء الله أيام سعيدة وعمر مديد بأطفال سعداء يملون حياتنا.
اختي مريم، بس سؤال، كيف شعورك وانت تخيلين الطفل يطلع من انبوب صغير؟
اي نعم، سبحان الله. الله سبحانه وتعالى اعطانا هذه المعرفه. المهم في هذا الموضوع اخوي قاسم ان كنا نسمع وايد عن اطفال الانابيب وطرق الاخصاب، اليوم هاي كلها متوفره عندنا في دوله الامارات، والاجمل من ذلك ان في قوانين معتمده تحافظ على حقوق هذا الطفل والوالدين وكذلك الطبيب اللي مباشر في هذا. وخاصه من خلال التخصص، تعرف عندنا امراض وراثيه كثيره كانت ما في بدائل قوية، اليوم الحمد لله الدولة موفرة هذا الشيء وتتكفل تماما بالمصاريف المالية لهذا، والحمد لله نقدر اليوم حتى لو في تاريخ مرضي لأمراض جينية موجودة نضمن بإذن الله الطفل الجديد نقدر نختار الخلية اللي بخير اللي ما فيها الطفرة الوراثية ونردها في بطن الأم ويكون طفلها بخير، وأجيال الإمارات يكونون بصحة أكثر من السابق.
الحمد لله
إن شاء الله.